Good morning, Liz. Thanks so much for making time for this interview to talk about your PhD this morning.
Thank you so much for inviting me to join in on the conversation about it.
Liz, you're one of FISI's PhD scholars, and I've loved listening to and hearing from you about the progress of your PhD while you've been in our office and part of our team across the last year or so. And I'm curious to hear some more about it today. I'm curious to ask you a bit about how you came to this particular topic. But Liz, you've been involved in research and been a research manager at a large not-for-profit. You've been a CEO of the NEP Centre, which is a specialist mental health employment service. And you've got really extensive experience in both management and research in the sector. So I think that's a really valuable experience and insight to bring to a PhD. I keep calling it project. I think it's a bit more of a life event than it is a project. So Liz, can you talk to us a little bit more about your motivation to do this particular topic? Explain what your topic is for us and why you chose this topic.
Yes, so my research topic was really exploring the experiences of people with mental illness as they transition to the National Disability Insurance Scheme. So I interviewed 30 people about their experiences, 20 of whom have mental illness and 10 of whom were actually NDIS professionals who work for the NDIS and have a role in assisting people to transition to the NDIS. And the project took over a period of 4 years of my life and actually coincided with the rollout of the NDIS. So my project started in 2016 at the same time that the NDIS was being rolled out across nationally. But my focus was on Victoria. Yeah. I guess my motivation for doing this project was twofold. One was related to my own professional development, which you've already talked about in the mental health field. But whilst the other was to explore the sort of social justice implications of NDIS policy and also design as it relates to people with episodic mental illness. So in relation to my professional motivation, whilst I had a well-established career as CEO and service delivery manager working in the community mental health sector, in 2012 I changed direction slightly and took on a research manager role for the large mental health disability service and at the time NDIS provider. And although the practical experience and passion, I guess, for research work, I lacked the academic rigour to support the research activities of the organisation. And in some ways, I felt like a research imposter. And therefore, I kind of sought to legitimise my role in research through accessing a PhD pathway. And so whilst considering my options to pursue further study, I was just delighted to see advertised a PhD scholarship through the industry partnership with Victorian Council of Social Service, VCOS, and RMIT University, which was the precursor to the Future Social Services Institute, where we speak from today. And I saw it as a perfect opportunity to marry both my industry knowledge and expertise whilst also formalising my academic research skills. And while connected to the first motivation, the second motivation for doing my research was to look into the experiences of people with mental illness as they transition to the NDIS. And by listening to the stories of 30 interview participants and documenting both the challenges and I guess the positive aspects of people's experience of the NDIS, I hoped that my research would provide insights for future policy and practice. So they're my two motivations, I think, for my research.
Thank you for sharing, Liz. It's an incredible undertaking to start a PhD, and I've watched how diligently and hard you've worked at it. So it's really interesting, the connection to thinking about the nexus between academia and research and building an evidence base and the practice, having come from the sector and understanding what this sector needs. So on the basis of that, share with us a bit about what your findings are. I'm really curious about the workforce implications, but just more broadly.
Yeah, so I'll begin more broadly before talking about the implications for workforce, but I forgot to mention earlier the title of my research was Gateways and Gatekeepers, the experiences of people with episodic mental illness during transition to the NDIS. And the findings from the study revealed that there were some system-level structural barriers and also some rationing decisions by some of the NDIS professionals who serve as gateway operators to the NDIS. They led to different pathways for people experiencing mental illness. Of the 20 people that I interviewed with mental illness, there were 7 of whom were ineligible for the NDIS. And so I was keen to see what the impact for them would be, as well as the impact for people who were eligible. So the findings revealed that there was 2 pathways. One pathway for those who were eligible, they got greater access to choice and control and social inclusion, whilst the other pathway for those who were ineligible, their future was less certain as funds were being directed away from existing mental health services towards the NDIS, highlighting a service gap. And this is of particular note in Victoria, as under the bilateral agreement, the majority of community mental health services are being replaced by the NDIS, leaving those ineligible, even despite experiences of severe mental illness, without adequate support. And although their experiences were not always positive, eligible consumers at least had access to some level of support and services, whereas those who are ineligible expect to receive little or no support. And for those who don't qualify, I think that the collateral consequences are many, and especially had an impact on mental health recovery. And in some aspects, the impact of not being eligible for the NDIS had a deficit impact on their recovery. So quite concerning. The other finding before I talk about the workforce was that in relation to people whose experience of mental illness is episodic, so majority of people with mental illness experience fluctuations in their mental health. You know, one hand being feeling very well and in other occasions feeling not so well. The impact of mental illness is it's very difficult to predict how and when they might need supports and services. So one of the findings from my research emphasised the structural challenges of the NDIS design, and reflections from both groups I interviewed, so the people with mental illness and the NDIS professionals, is really found that NDIS is not yet well equipped to support the specific needs of people with mental illness, especially as their mental health fluctuates. And so my research suggests that the NDIS system requires a sort of a policy shift to better reflect mental illness. And it needs an organisational structure that's more agile and flexible, I think. And the NDIS professionals also highlighted that the NDIS was not flexible enough, and they would like to have some flexibility around that. So moving on to, I guess, the third final major finding was that around the NDIS workforce, the people that I interviewed, I was really pleased to see that the majority of them really were committed to providing the best support that they could for people with mental illness. And they did have an approach that was inclusive and person-centred, so focusing on the person. But the people with mental illness, some of them found that the workforce of the NDIS professionals, that some of their knowledge of mental health was lacking, and that they would have liked to have seen somebody with more knowledge of mental illness. When I was talking to the NDIS professionals, they were not aware of the NDIS actually developed some modules around mental health and mental illness, and the uptake of those modules was quite low. And that was not because of lack of commitment from the NDIS professionals, but because lack of time and resources. Lack of time because they had challenging targets to meet in terms of the NDIS rollout and getting people on board. They also had challenges in terms of the NDIS workforce because there was a high staff turnover at the beginning. And so that, I guess, impacted their capacity for uptaking the mental health training, but it certainly wasn't due to any lack of commitment. So the people with mental illness who I interviewed suggested that perhaps there could be more people with a peer mental health workforce. So peer being people who have lived experience of mental illness. And in my research, I refer to them as being kind of recovery allies, or I guess peer workers supporting people with mental illness so that they have that knowledge. So they suggested that might be a good idea, but at minimum for people to have some training in mental health and particular type of focus on recovery.
Liz, it's incredibly timely, this piece of work, given the Royal Commission into Mental Health and the points that you're making about how do we educate the broader workforce around understanding mental health issues and how to respond effectively. And I think that concept of peer workforce is really picking up traction. So I think that the work that you've done will really add to the evidence base to inform where we go to from here. So really look forward to talking about this with you more, Liz, as you move into other roles and stay a friend of Fizzies and stay in the sector.
Oh, I look forward to doing that because I would really like to have my research have some impact on future policy and practice. And it is pleasing to see that the NDIS is moving towards they're receptive, they understand that there needs to be improvements made for people with mental illness as they access NDIS. So there's certainly an appetite for it. And I do hope that my research will contribute to developing that further.
Thank you, Liz. Thank you very much and look forward to talking about this with you further.
Thanks, Micaela.
Bye. Have a good day.
Thank you.